This is what chicken bone looks like under the microscope, but how did we get here? We showed you this process with lung a few weeks ago, but it's a little different with a hard specimen like bone. First, we picked out a fresh pack of chicken thighs at the grocery store. In a typical lab where they're processing for diagnosis, the specimen would be collected from the patient in the operating room. Next, we brought the chicken to the lab and performed grossing, where we cut the bone into small sections to fit into cassettes. Next, instead of going directly to processing, we took a detour to the BoneSTATIon to decal the bone using our non-buffered mold decalcifier EDTA solution. The decalcification process, as you could guess by the name, removes calcium deposits from the tissue. We do this in bone samples to soften them up before processing in order to be able to easier cut the bone at microtomy. After that's soaked in decal solution for a few hours, it's time for processing. This involves dehydration, clearing, and infiltration with paraffin. Then we head to the embedding station and embed the bone in a block of paraffin on our embedding center, which keeps the tissue in place for sectioning. Now onto the microtome to slice the bone into thin sections, place them on a slide, and send to staining. Next, we stain the chicken bone with toluidine blue and H&E to highlight different parts of the tissue so we can see the details clearly under the microscope. And that is how chicken bone goes from the shelf of the grocery store, or in most cases inside the patient, to under our microscope.